This is an overview of the new discharge routine in Meditech that will go live this summer. First, I'm going to talk a little bit about the benefits of the routine, why we're using it. Another will be the physician obligations for interacting with the routine. And then lastly, instructions on two different ways to access the routine from within Meditech. So first, as far as the benefits of it go, as I've said before, it's a multidisciplinary module that allows multiple different disciplines who are caring for the patient to see what the status of discharge planning is. And it also doesn't just put all the onus on physicians, but also you'll see how nurses and case managers and clerical folks will be supporting as well. Another benefit is that the output of this discharge routine is something that goes to the patient in a printed format initially and eventually to the patient portal, and it's much clearer than instructions they're receiving presently. Another is that the discharge medication reconciliation process results in prescriptions for new medications being printed out on the units rather than having to rely on prescription pads. There'll be the secure prescription paper in dedicated printers for this process. It is also one step closer to e-prescribing, obviating the need for paper altogether, which will probably be evolving over the next 6 to 12 months. Another benefit is that the discharge planning process can be teed up ahead of time. It makes it easier for one physician who's cross-covering another to discharge a patient if his or her partner has set it up the day before. You can do it in an iterative process during a long, complex hospitalization to make the day of discharge easier. Lastly, several of the electronic interactions here will be able to result in things flowing to an eventual discharge summary. This isn't an immediate step, but hopefully in the very near future, the discharge medication list and problem list can flow to the discharge summary, making getting around the need to having to dictate and recall all these things from memory. So those are some of the benefits. As far as the requirements are concerned, there are three main elements. One is making sure at least one pertinent problem is in the problem list. This is helpful because the problems entered via the discharge routine and dedicated to the current visit will be what flows to the health information exchange and eventually out electronically to referring providers, primary care doctors and others, and also have the potential to flow to the patient portal as well. The second requirement is to place electronic discharge orders. This is using the same module, POM, CPOE, that are being used for other orders as well. And some of you already been using discharge orders, so there won't be a big incremental change here. And then lastly is doing medication reconciliation to the time of discharge, identifying discharge medications. This will be the hardest part of this for most folks to interact with. So those are the requirements for attending physicians. I do want to add that consultants are not off the hook totally either. And if you're prescribing a medication to a patient that you want the patient to take at home, rather than writing it out on a prescription and then letting the attending integrate all this into the discharge medication reconciliation process, the expectation is that you'll be interacting with this routine to create the prescription and also tee that medication up for inclusion in the discharge instructions and the discharge med list. So that's an overview of the benefits and the requirements. I want to show you how to access it. So once within an individual patient's EMR, down on the right side here, you see this discharge button. This has actually always been here, but it's been low lit. Now it is high lit, and when you click it, it will take you to this screen here with the problems, the discharge and planning orders and discharge medications, as well as other elements in the routine. I want to show you another way in as well. If you're using the physician desktop to access your patient list, over on the left side here you see these different icons. This one here with the piece of paper with the arrow flying up off of it, I guess that's supposed to indicate something leaving something. That flips you to the discharge routine. Takes you to the same destination, just two different ways. So that's an introduction, review of the requirements, and instructions on how to access the routine.